Okay. Good morning, ladies and gentlemen. Thank you, Fergus, for a nice introduction. It's my great pleasure to be here and to present Croatia's perspective on the implementation of the new pharmacovigilance legislation in Croatia, being a new member state in the European Union since this summer. So I'm going to present you some of the practices that we already had before accessing the European Union, and also some new things that we just embraced by becoming a member of the European Union, and also the challenges that we are facing in this new and very active period for us. So we joined the European Union on July 1st this year, and on the same day, Croatian Medicinal Product Act and accompanying bylaw on pharmacovigilance entered into force. So now the Croatian legislation is harmonized with the European legislation. However, we have already adopted the European Pharmacovigilance Directive even before entering the European Union, and have been practicing really a lot of things even before, but not actively participating in some European EMEA bodies like now. So the Croatia started using Vigilance gateway for ICSR submission already in 2010. We started with patient reporting of adverse drug reaction in 2009, and also introduced online patient reporting in 2012. We also started with assessing RMPs and risk minimization measures already in 2008, and the first healthcare professional letter was issued back in 2005. But now, with entering to the European Union, we are now active participants of the EMEA scientific committees. We are starting to take over referrals and the role of a rapporteur in those committees. Also, we are now implementing the recommendations, PRAC recommendations nationally. We will be also handling the signal management for the designated substances that we will be in charge. Of course, we were doing it before on the national level. And also, one new thing for our agency is the pharmacovigilance inspections, which was previously under the scope of work of Ministry of Health of Croatia. So when I was thinking what good example of the old practices we had to show you, I decided to present you the patient reporting, which started, as I already told you, in 2009. We started with the paper version form, which could have been downloaded from our web page. But at the very beginning, the figures were really very small, very small figures of patient reports at the first years. Then, in August last year, we decided to start using the Uppsala Monitoring Center application for online patient reporting. It happened in August last year together with the Olympics in London, so I think it's a good correlation there. And actually, we were the first country in the world to start using this application for the patient report. So we used this sentence and had extensive media coverage about this report. And really, what was the outcome of this media campaign for patient reporting is that I think the figure speaks for itself. We had a steep increase in the number of patient reports starting from 2009 and 10, which was really just a few of them, to the figure which was really climbing like this after the online reporting has been established. Beside the media campaign that we have had, we also posted information on patient reporting on our webpage. We have printed a booklet about ADR reporting, which was distributed to patient organization, and it's available also for downloading on our website. We have delivered lectures at the different patient organizations, and one of the good examples were the European Transplant and Dialysis Games, which were held in Croatia last year, also in August. And I think it correlated very well with the whole campaign, and this was really a very good collaboration. Also, we have put a link on online patient reporting on many healthcare web portals in Croatia, so that this could be accessible really to the large amount of patients. So learning from the good experience from the last year, we decided to have another campaign, which started just 20 days ago on the 5th of September. And the name of the campaign is HALMED. HALMED is the name of our agency. Public educational campaign promoting importance of patient leaflet reading and ADR reporting. We are just in the middle of the campaign as we speak. And it's conducted on a national level. We have, it will be 2 months duration until the end of October. And it will have two main messages: importance of pill reading and also importance of patient ADR reporting. So just to give you a little sense of the media that is going on in Croatia, this handsome-looking guy is saying that you wouldn't assemble your furniture without reading a manual. So also you should read the patient information leaflet before using a medication. And the other one, women correlate with this Iron lady, that if this happened to you, you wouldn't just ignore it. So you should report the adverse event reports. The media was really huge. We had a press conference, press releases for different newspapers. We started with billboards by the main roads in whole Croatia. Then we have the advertisements in the newspapers, on radio. And beginning of October, we will start with distributing campaigning leaflets at pharmacies, at the GP offices and the primary care offices. So we'll see. I have the first results. So if you look at the blue curve here, here you see how the figures have grown. This is August, last month, and this is now September. So for the first 20 days of the campaign, the number of patient reports increased 6 times in 20 days compared to the previous month. And if you look at the peak before, in March this year, this was the time when we published the annual report on spontaneous reporting on our website. This was then extensively covered by media, and then you can also see how it correlates with the number of reports. For the new things that came with the European Union, the first thing, which is a bit of a local specificity, is the marketing authorization person responsible for pharmacovigilance in the Republic of Croatia, which is in addition to the QPPV, so the qualified pharmacovigilance person on the level of the European Union. We have a requirement for the local person also in Croatia, which must reside in the Republic of Croatia. He would be in charge of for establishing and implementing the pharmacovigilance system in our country and have an overview of safety profiles and any safety concerns that might come for the medicinal products which are authorized in Croatia. This person will serve us as a contact point available 24 hours and also will be the contact point for pharmacovigilance inspections. The other thing that was that happened really just 10 days or 15 days ago is the internal audit that was held on 11 and 12 of September of our pharmacovigilance system. It was really under obligation from Article 101 of the directive that member states should perform regular audits and should report the results to the Commission by 21st of September at the latest. So we did. And the report was really good, so we have the adequate, appropriate, and effective processes to provide reasonable assurance that potential risks are being properly managed and objectives met. I think this audit really came in a good time for us because we were just 2 months members of the European Union, and I think the beginning of our membership is really the good time to make some changes if necessary and also to introduce some new practices if needed. So at the beginning we already went throughout the whole system and found out that it's really working properly. Also for the new practices that came into already older procedures, I would like to present the review of the educational materials, which started, but really sporadically, in 2008. So it was now and then coming one or few educational materials to us. And then by the end of the last year, we realized that we really need a systemized review of all those educational materials that are on the market. So in collaboration with QPPVs, we have distributed the questionnaire, actually it was an Excel table, to all local QPPVs and asked them for feedback for the questions that we had. Actually, the table looked like this. So we sent it out to every marketing authorization holder in Croatia, this spreadsheet, and they were asked to name the names of the medicinal products which are on the market, and if they have the educational materials, and also if they are mentioned for the healthcare professionals or for the patients, and also to explain the purpose and what these materials consist of. And we have a very good response rate from the marketing authorization holders. It was really a quick action and the good one, and about 90%, 95% of answers were received really in the required time, in 15 days. And following this good feedback really enabled us to do the tracking system now for the educational materials. And also now we have the possibility to track updates and different material versions. So the agency puts the versions which has been checked by the agency on each and every educational materials. Also now we are sure that we can make obligatory paragraph to every educational material about the obligation or possibility to report adverse drug reactions included in every material, because in Croatia it's healthcare professionals are legally obliged to report ADRs, and patients of course have the possibility to do so. Now coming to transparency, that was mentioned so many times this morning. This is the new regulation requirement that we are planning to use in the near future. So we are planning to publish the educational materials on our website. But of course there are a few things that we need to reflect on and to see how we are going to proceed. So first, should we make all materials available to both patients and healthcare professionals, or should we divide the viewing rights? We are more prone to the first option now. Then in which form to these materials to be published? Should we put them in a table listing all the materials, or actually to put the PDFs or photographs or whatever of the educational materials used? And also as we have to do it now to start, we need to think if we are going to do it in a bulk, so wait for a certain time and then publish them all together at one time, or we are going to do it successively, so as they come, and then to keep them publishing on our website. Also, the new challenge for the educational materials are the group materials, because there is a need to have only one material for the same active substance. Having different materials for each medicinal product with the same active substance is really counterproductive, because if you have a healthcare professional receiving 9 materials for the same active substance which are different, I think they all end up in a waste basket at the end, and this is really not the objective that we want to achieve. So this would be the challenge that we have to do in coordination with marketing authorization holders, and to decide how we are going to proceed with this. Also, the education is always an important point, so we need to educate our healthcare professionals both and patient organizations to highlight the difference between the promotional materials and educational materials. Sometimes this is not very clear for our doctors, and I think we need to emphasize this difference. We have a medicinal product safety committee within our agency, which consists of the doctors and experts from healthcare institutions from all around Croatia, and they convene every month. So as a first step, we are using them as a voice of education, because when they can come back to their respective institutions, they can educate their colleagues through the local drug committees and informal meetings. Also, we would like to emphasize what was said before, the difference between group and the specific medicinal product materials, and to have the agency visibility on those educational materials. Also, we need to follow up on those materials. So the task that we have just started to do is the pharmacovigilance inspection. And this is going to come in a very near future, so we will check if all actions agreed with our agency have been performed by the marketing authorization holder. The other thing is, as Peter said in his speech before, is the measuring the effect and the outcome of using those educational materials, which is a bit more of a challenge, I would say. How to do it, which method to use, and I will leave you with this thought to be determined in the future what we need to do, maybe some studies or what methodology to use to actually measure how those educational materials really worked on the field. So I think we have shown some proactivity and also engagement of patients in our system in Croatia, some transparency and some action, so all the words that have been mentioned before. And this is just a snapshot of pharmacovigilance reality in Croatia. And this is the snapshot of a Croatian pharmacovigilance team. There are not so many of us. And we have a guest here from EMEA, Andreas, which came to visit us this summer just for the training purposes. Thank you.
So thank you very much, Marina. Some very good insights and very practical initiatives also that you're taking, for instance, on the educational materials, I think very useful. So questions, experiences from the audience? Please go ahead.
Thank you. My name is Kaisa Immonen-Karalambos from the European Patients Forum. I really liked your initiative on preparing information materials and publishing them on a web portal. And I just wonder, as you mentioned whether all materials should be available to all user groups, I would strongly recommend that there shouldn't be any restrictions, but I would perhaps recommend that you could involve the Croatian patient and consumer groups in actually developing the materials and seeing what is relevant for patients and medicine users, and then to make sure that the information is presented in a way that meets their needs and it's really understandable, because obviously the way a layperson, what the layperson reads, could be different from what a healthcare professional might want to read. So have you actually involved the patient and consumer groups on a sort of more permanent basis of collaboration in this? That would be interesting to know. Thanks.
Thank you for this. I think it's very valuable advice and that we are certainly going to take into consideration. It's just the starting procedure, so of course we are planning to engage all the patient organization, and their input would be valuable, because we just didn't want to have the counter effect with having patients the educational materials which maybe wouldn't be in the language that they will understand, or maybe to intimidate them at some point. So involving patient organizations in developing materials, I think it's a very good point, and I will take this back home.